So I've just seen a patient with a 4-week history of left medial knee pain, which is his lead leg on the golf course. He hasn't sustained the injury on the golf course. There's not been any trauma, but it is affecting his game. So he's in his 60s. He's not getting any better since it started. He went to MIU. They told him he needed a scan, which isn't always the most helpful thing, but we'll come back to that. This is quite a common issue that we see, and particularly in people on the golf course as they get a little bit older. And his pain is coming from the cartilage. The cartilage in your knee is the cushion between your thigh bone and your shin bone. As it gets older, it gets a little bit thinner, it gets a little bit more susceptible to becoming painful. It isn't necessarily that it's damaged, it is less tolerant of some of the loads that we put on it. And it will have been getting probably degenerative for a long time until it gets to a point where it becomes painful. So this is something that is very, very manageable. So the things that it typically won't like is the more we flex the knee, the more likely it's going to get painful. So if you're going down to pick your ball up out of the hole, you might feel it if you're standing on that left side. Knees like this really don't like being twisted. So of course, when he's swinging his golf club, as he comes to on his follow through, that can cause problems. And again, more time you spend on your feet, the more irritable it's likely to get. So if you're walking four-ish miles around a golf course, this is why it's really starting to impact him. So best way to manage this type of knee. The first is it probably needs a little bit of relative rest, so a little bit of a breather from the thing that's aggravating it. So it might need a short bit of time, a few weeks maybe away from golf just to let it settle down. You might find you need a short course of painkillers. You might help with getting some ice onto it. When it's on your feet, you might find that a knee support is quite useful. And the main thing, as always with most of these conditions, the right exercises to target the muscles around the knee that support it will help enormously in the large majority of cases. When you get back on the course, once it's settled down, you might still find the knee support is useful, but the other thing you might find useful is a little tweak to your setup position. So for a right-handed golfer, if I'm getting left pain, I might just want to turn that lead foot out ever so slightly into a little bit of rotation, just open the stance a little bit. So when I come through on that knee, I've already got a little bit of rotation away from it. So it might just make it that much more manageable when you're swinging your club. Coming back to imaging, look, if these types of knees really aren't getting better, and you need to give them probably a good few months to see if they're going to improve, you might find that you want to get an X-ray to see if there's any arthritic change in that knee. If that doesn't show anything, an MRI scan might be useful to see if there's a little bit of a degenerative tear or maybe something a little bit more substantial. This doesn't necessarily mean you're going to need surgery, but it will give us a little bit more information to make sure that we are managing it in the best way possible. So if you've got knee pain that you want to discuss, drop me a message and we'll get you back on the course as soon as we can.